Well, hello everyone. It's Chris Paul again from Intuitive Wellness. Good to see you. We are starting back up with Wellness Wednesdays, and just for the sake of being crazy, we thought we'd do one today on a Tuesday. So today what we are doing is we have a special opportunity. Intuitive Wellness, as many of you know, has grown. We are in a new location and we have many more services than we had before, and one of those services is acupuncture. And so today we have the opportunity to meet our acupuncturist, Hannah Jefferson, and to see her actually do an acupuncture session so that you can have a feel for it before you come in. So hopefully this all works. Forgive the masks. We're going to talk louder if we can. We double mask usually, and we're going to check in. Our clinician, Chelsea, is actually our client. So everybody here is an intuitive person, but we're going to, nonetheless, this is Chelsea's first acupuncture session, and she has agreed to do it for all of you. So hopefully this works. I'm going to flip this around. All right, so Hannah, hi. Nice to meet you. Welcome to Intuitive.
Thank you.
So let us know basically what happened before we got in the room.
Yes, so as we start every session, I sit down with the client and we kind of go over health history, what is bothering them, if there's any specific challenge, whether it's something emotional, something physical, maybe both. And I just kind of get the lay of the land to see what their concerns are and why they're here, and if they have any questions for me about what I do, about acupuncture, about really anything within the scope of the treatment room and what we do. I always go over everything with the client so that they have an understanding of what's going to happen, because it is placing needles in their body, so there definitely are people that can be a little nervous about that, but we always work within that and make sure they feel incredibly comfortable and ready to receive the treatment. And then after we chat about things, I have a diagnosis and a treatment in my mind in terms of a plan. We get them on the table.
Well, let's pause there. Let's not get too far ahead, because they're going to get to see all that. As fun as it is talking to you, they want to see it.
Yeah.
So I'm going to let you take us in. We'll check in with Chelsea first, and then we'll hear about what your plan is for her as we go in. So we're going to be walking. We're going to follow Hannah into treatment room 2. Normally this room would be slightly less bright, but for the sake of cameras, we're going to go in. So most of you in our Intuitive family know Chelsea. Say hi, Chelsea. Hi. Chelsea is one of our fabulous massage therapists, and she has agreed to get her very first acupuncture session here at Intuitive with Hannah. So Chelsea, before you hop up on the table, what are you hoping to get out of today?
So I currently have a headache and back pain. The headache stems from this side, and then some just personal stress. So hopefully just relaxation and clear up some of this pain.
Okay, so over to you, Hannah. So based on that, you guys talked for about how long?
20, 30 minutes.
Okay, great. And so now, is she to get up on the table? Is that the plan?
Yes.
All right, so let's go ahead and have you do that.
You can get under the sheet and blanket.
So she doesn't have to get undressed for acupuncture.
So sometimes it depends on what we're doing. So for the sake of today, I'm going to be doing some points on her hands, feet, and head face area. So for this example,
She didn't need to get undressed, just socks and shoes, really.
Just socks and shoes.
Okay.
Sometimes if I'm doing a treatment on the back, or I need access to the upper thigh or something like that, I might have them undressed for that appropriate treatment. But for the sake of today,
she gets to keep all her clothes on, so yay.
Yeah.
Okay, so now Chelsea, this is your first ever treatment.
It is.
How you feeling about it?
Slightly nervous.
All right, so I think I'm okay to share with you with folks that what you shared with me. You're a super big fan of needles, is that right?
I hate them with passion.
All right, she's had 2 babies, but hates needles passionately. So she's a great candidate for all of our clients out there who are also haters of needles and think they can't possibly do this. So Hannah, you mentioned that you were gonna check in and then you kind of make a diagnosis. So what have you decided is the best course of action for Chelsea?
yes, so from a 5-element acupuncture standpoint, there's 5 elements: water, wood, fire, earth, and metal. And within each of those, there are different organ systems. So based on whatever symptoms are being presented, you can kind of figure out which element is having challenge and then treat those channels accordingly.
Okay.
So based on everything that she's told me, we're going to be working with her liver and gallbladder channels today to move physical stagnation, calm the mind, harmonize the emotions, and reduce pain.
Okay, so let's bring out some needles and see what we got going on, because we've got some folks who are watching who are going to be thoroughly freaked out, I think, but let's do it anyway.
So actually, before I do the needles, I do want to listen to her pulses first.
Okay.
And just for all of your knowledge, this is different than when a nurse listens to your pulse for rate, because we are listening to 12 different pulses. They all are in accordance with different organ systems, and so I'm listening for strength, quality, quantity, how they're interacting with each other, and this helps to fuel my diagnosis in terms of what systems need to be treated today. So we'll give those a quick listen. And this is something that we do before and after treatment, so it's a way for me to tell what has shifted, because sometimes for people they feel a big shift right on the table, other times they don't feel it till that evening, or maybe they wake up the next morning and think, oh my gosh, I got the best night's sleep of my life. But this allows me to see what has shifted even before the client can feel it.
Okay.
So now we're bringing out the acupuncture needles.
Excellent. So we're going to stand at kind of this angle so that we're not in anybody's way, but we're going to come in a little closer as the needles are being done. I want everyone who ends up watching this to get to see the actual size of the needles and to see them be inserted. So as a warning for anyone watching at home, if needles make you queasy, there shouldn't be any blood or anything like that, but you're going to actually see needle insertion. So might not be your favorite thing to do with children.
Would you like me to come over and show the needle first?
No, you get to Chelsea and I'll bring the camera to you.
All right, so I'm going to start with one point in each ear.
All right, so let me just get a close-up of that. So there is the teeny tiny little needle, okay? And we're going in her ear, you said, which sounds thoroughly creepy. I'm not going to lie, but I've had them done to my ear, so go to town.
All right, go ahead and breathe in and out.
So Chelsea, you did not move during that experience. What did you feel?
Like a little pinch. Like I can still feel it though. Does that
Okay.
make sense?
Yes.
Yep. So I'm going to just be really close to your face for a minute. But if everyone can see that that is the needle in her ear, she's not bleeding. It's just sort of dangling. It's not this right here. That's her earring. It's this right there. Okay.
Now I'm going to go over and needle that on the other side.
Okay.
Breathe in. And out.
All right. And was that about the same for you, Chelsea?
Yep.
So far,
pinch.
a little pinch. So less than a shot? If I were giving you, let's just say a COVID vaccination, is it less than that?
Yeah. Well, yes.
Okay. Less than giving blood? Doesn't feel like that?
No.
Okay.
Does not feel like giving blood.
All right.
And one important thing to note is that sometimes you might feel more sensation on one side of the body than the other. If it is a little more pinchy on one side and you maybe don't even feel it at all on the other side, that's totally normal, and oftentimes that means that where the pinchiness you're feeling, there is a little bit of stagnation on that side of the body that needs to move. So it's usually a really good indicator that a lot of chi is going to be opening up and flowing in that area.
Gotcha.
So now I'm going to do 1 point here and 1 point here.
Okay.
Breathe in. And out.
Is that weird that something was put into your head by your face,
Pretty much.
but not any more or less
Actually,
uncomfortable?
Where I can like feel the ones, I feel like they're hanging off my ear. 'Cause
Yep.
I have no idea my eyes are closed. I don't really feel it after it's gone in.
Okay. And that, from where I'm sitting, and you'll get to see this video later, they are a little bit hanging, right? Because they're not like all the way in. And I think for those of you at home, you can see these don't like go into the bone.
Yeah, they're very shallowly inserted.
Yes. Okay.
Now over here. Breathe in. And out.
Everything on this side, on my left side,
Is more
is
tender.
more tender.
Okay.
But we already knew that because that's where the headache is.
So for those of you who might not be able to hear because of the masking, Chelsea came in with pain on her left-hand side through her neck, shoulder, and up into her head, causing her to have headache pain. And what she's noticing is that the needles going in on her left side are more sensitive, but not unbearable so. Like,
No,
it's not like...
Again, it's just like a little, it's a pinch, and then it's gone.
So if 10 is like giving blood and 1 is not getting anything put in, 0 is not getting anything put in you at all, then where would you say the discomfort level is?
Like a 1 or a 2, but for an instant.
For an instant. Okay, got it. Moving on. Yep.
And I'm going to do one right between your eyebrows. Breathe in. And out.
And for those of you watching, if you want to know a little bit more about how Hannah is qualified to do that, we're going to talk about that when we step out of the room.
I'm going to do one on the top of your hand. Breathe in. And out. Breathe in. And out.
So that's 1, 2, 3, 4, 5, 7 needles that you've done. How many do you think you'll be doing?
7, 11.
Okay, so we have a few more we're going to do for,
There's a couple on the feet.
okay. We're going to come down here. Hopefully I'm not moving around too much, making people ill at home.
Breathe in. And out.
Chelsea, your feet are famous now.
Oh, that could
Your feet
not
have gone
be
live.
great.
So I'm going to just move because I had the salt lamp directly behind and that might have been difficult to see. So we're going to do it from this angle, but you can see that teeny tiny needle right here that has gone in.
Breathe in. And out. You got 2 more. You're doing great.
All right, we're going to do 2 more, she says.
Breathe in. And out.
So sometimes it seems like when you put it in, there's a little bit of movement that you do.
Yes.
Is that deliberate or are you not quite where you want to be or what's that about?
Yeah, so there's, sometimes you're just sticking the needle right in, sometimes you manipulate it to the left or to the right. The purpose of this is you're telling the chi where to go and how to direct it. So if you're trying to disperse chi, you turn it one way. If you're trying to what's called tonify chi or build it, you turn it a different way. And if you're just sticking it straight in, that oftentimes is a good way, like we do that for the ears so that the body can decide what it wants to do.
Okay.
But if you definitely want to disperse chi, for example, you make sure to,
Give it a little move.
yeah, give it a little sense of direction.
So after she places this needle, we're going to step out and we'll talk to Hannah one-on-one while Chelsea just experiences all this movement.
Breathe in and out. Okay.
So this is a full shot. She's got 2 in each feet, 1 in each hand, 1 in each ear, and basically 3 along her forehead. Chelsea, how are you feeling?
Fine.
All right, and how long will she lay like this?
About 20 minutes.
About 20 minutes. So we're not going to talk for the full 20 minutes, but we're going to turn the lights down. I'm going to flip the camera back around so you're not all dizzy, and we're just going to walk out and have a quick chat. So we'll turn the light out, and we'll give Chelsea some time. It's going to get bright. All the light's going to be confusing for a minute as we walk into my office and have a chat with Hannah So we're going to just talk for a few minutes, and then what we're going to do is I'm going to stop the video because it would be a bit much to watch, to just sit here and talk for 20 minutes. And then we're going to go back in about 20 minutes when Hannah removes the needles so that you can be a part of the removal process and see how it is that Hannah is feeling at that time. So right now I'm going to flip the camera back around and talk with Hannah. Okay, so just to help me understand, first of all, massage therapists that are only trained to be massage therapists can't do acupuncture. Is that right?
Yeah.
So what level of education do you have to get to do this?
So it's a master's.
Okay.
And you have to have some sort of bachelor's undergraduate education in order to qualify to do this program. It is 3 years of year-round school, so lots of learning and in the classroom and in a clinical practical setting. So you do work with patients at under teacher supervision as well to really hone your skills. And yeah, when you graduate, you have a master's of acupuncture, and then they have doctorates
And whatnot.
herbal and all the other
Okay.
things too.
So when you leave them in the room, what's happening right now? What is Chelsea experiencing for these next 20 minutes?
Yes, so it could be a number of things, but essentially what's happening is the needles are starting to interact with each other to facilitate a movement of chi based on what my treatment plan is. So for her, we're looking to clear energy from her. So her headache is actually along the gallbladder channel. So we're working to basically unblock that channel and facilitate movement of chi so that everything opens up and pain begins to be reduced. We're also looking to calm the mind and just balance the emotions. So for the stress, and what's fascinating is she said I could share that she has been waking up during what's called liver gallbladder time. So according to the Chinese clock, each organ system has a 2-hour window where it's at peak function. So if you're having issues during a particular time, it can be indicative of something going on with that organ system. And so the liver and gallbladder, which are the channels I was working on with her today, are what's called sister meridians. And she's been waking up pretty much every night at liver time. So from a diagnostic perspective, that's indicative of something's going on with her liver channel. And those channels also relate very directly to muscle pain, stagnation, irritation, all kind, feeling emotionally stressed. So there's a lot of different factors at play here that are leading to that diagnosis. And so what the needles are doing now, as I said before, is moving the chi, unblocking whatever needs to happen, and allowing for a sense of deeper calm.
So let me just hop in here. So
Yeah.
I just want to clarify for folks because I want to be careful with the diagnosis.
Yeah.
So you're diagnosing this from an acupuncture perspective. You're not telling her, Chelsea, you have liver problems or you have
No.
gallbladder problems. This is just about chi and the channels that are blocked within her body and
Correct.
what organ systems might be involved. But this isn't to say that this is indicative that Chelsea now has a liver problem or
No.
what have you. Okay.
Yeah, so it's the liver meridian and the gallbladder meridian.
Okay.
So it's from an energetic perspective.
I understand. Okay, great. So when we go back in, actually, let me ask one other question. So your first session is 90 minutes, and why do you need the 90 minutes versus the hour for our folks who might want to book an appointment?
Yeah. So in the beginning, I don't know anything about you, and so we do talk before each session, but the first session is we talk longer in the beginning because I do need to get a full lay of the land, a health history, to really understand the full scope of you and what your concerns are. So we do speak for about 30 minutes or so in the beginning, and then a treatment follows as part of that 90 minutes. So that's why it's a little
It's
bit
just more
longer.
involved. Yeah.
Versus in the follow-ups, it's like a check-in. Hey, how did you feel after the treatment?
What
What
worked,
changed?
what didn't.
Didn't change? And then we fine-tune and go from there. And that's what more of a typical session would look like.
And acupuncture can be added before or after a massage or
Oh,
a
yeah.
facial treatment and that type of thing. That's all fine.
I would say the only thing I wouldn't do is get acupuncture right after a facial, because if I do need to have you in the face cradle
Right.
and you've just gotten a facial, it might,
Disturb that.
yeah, I would
Okay.
say get acupuncture before a facial if that is something that you're concerned about.
Okay. Well, I'm going to flip this back around. I'm going to let you guys go for a little bit. We've got about 15 minutes left for Chelsea on the table, but if you'd like to check back in, we'll be back in about 15 minutes to remove her needles and see how her very first acupuncture treatment went. And for those of you who are interested, we do offer acupuncture treatments. Your initial session is 90 minutes for $125. Or once you've completed that, we have 1-hour sessions that are $85, and we even offer an acupuncture membership for $75 a month, which would be your 1 hour per month that you can check in for acupuncture. That's after your initial session. So we'll check back in and talk more with you as soon as Chelsea's session is done. So thanks for tuning in, and we'll see you soon.